Hello everyone, welcome back to another episode of r/AskReddit. Before we get started, make sure to subscribe so you will never miss a video. So let's get started. Doctors of Reddit, what is a disease that terrifies you but most people don't care about? Prion diseases, specifically fatal familial insomnia. Imagine one day you can't fall asleep for some reason. Within about 18 months, you'll be dead, and there's absolutely nothing you can do to stop it. My great-aunt died of CJD. Death sounded like a mercy compared to how she lived. Gads, I remember learning about prion disease in deer herds, and that was horrifying. Rabies is another disease where just thinking about it makes my blood run cold. The idea of suffering such a death makes me heartsick. There are two. Locked-in syndrome would be so utterly tedious you'd want to die, especially if it was misdiagnosed as a vegetative state. Severe central pain syndrome is so awful people with it frequently do kill themselves. A colleague of mine treated a woman who was diagnosed with locked-in syndrome. What made it worse is that she, the woman with the syndrome, was a nurse at the hospital she was admitted into. It was just so sad. Being aware of what's going on around you, but unable to move or speak. Hantavirus. Found in rodent waste and inhaled, makes you bleed to death before diagnosis. Rabies is nothing to mess around with either. Once symptoms appear, a miserable death is all that's left. At my old apartment we had a rat problem and my mom was super worried, because I think one of her relatives had died from hantavirus. Got out of that place as soon as I could and left all the rat shit for the landlord to clean up since he didn't want to hire an exterminator. I had to get vaccinated for hantavirus years ago. We got all set FO rev the complaint engine till medical told us what it can do. Jab away. Rabies. I read a thread that terrified me. It's a horrid way to go FA show. And you're already a dead man walking if you start to experience symptoms. It has a 100% kill rate other than one girl who survived, but basically became a vegetable. Thank goodness for Michael Scott's Dunder Mifflin Scranton Meredith Palmer Memorial Celebrity Rabies Awareness Pro-Am Fun Run Race for the Cure. Doctor, currently in residency. I'd agree with prion diseases that were already mentioned, but a terrifying one that is not as known as Hsv-1 Encephalitis. Caused by the herpes simplex 1 virus, which is incredibly common, mainly known for causing cold sores. Hsv encephalitis affects all age groups and almost always leaves people with significant neurological damage or personality changes. The exact pathogenesis is not known, although immunosuppression may increase risk. It's rare, but the fact that there is not much of a warning to it, and the fact that it can permanently change your personality and leave you with long-term neurological symptoms even with early treatment with antivirals is terrifying to me, especially with how common Hsv-1 is. Doctor here. Strokes. Risk factors include most of the pre-existing condition that nobody seems to care about: hypertension, diabetes, smoking. And once you get a stroke, it can be extremely debilitating and life-changing. I have seen people go from "but grandma was fine, just a touch of the sugars" to "grandma now can't move, talk, or feed herself." The fact that 1, your life can change from 1 minute to the next, and 2, the fact that you are basically a prison of your own body afterwards is just terrifying to me. Whatever we don't know that's killing us in plain sight. Thalidomide, DDT, asbestos, mercury vapor lights, lead paint, tobacco, all were common and accepted as safe 50 years ago. So what's going to be discovered next? Not a doctor though. Obvious answer is plastic. We're going to keep find more ways it can be bad for us, but it very quickly got widespread heavy use upon discovery. Add microplastics to that list. While the human body can adapt to low levels, we are steadily ingesting increased amounts to the point where it will affect our health. Med student here. Not really a disease, but antibiotic resistance is the bigger challenge we have in our future. Bacteria are evolving to being more and more resistant to drugs. Some have already reached a point where some strains are resistant to all our drugs. Luckily, this process will take decades to happen on a large scale, but we should not really speed up this process by taking antibiotics when there is no need and not finishing a complete course of antibiotics. If the doctor told you to take 8 pills, 1 a day, I don't care that at day 5 you feel fine and can run a marathon, you still have 3 pills to take. Otherwise you are just selecting the stronger bacteria that resisted the first 5 days. We should arrive prepared with new antibiotics and/or a completely new kind of drugs, and not fuck them again by using them wrongly. A word with no antibiotics is a word where you can die for things that nowadays are visit to your GP stuff. Alzheimer's is scary. Not even a doctor. Dementia is secondary, but still anything affecting the brain fucking is Akari. I'll add Huntington's disease to this list. For those who don't know of it, I would say it's Alzheimer's, but you rapidly lose your motor functions as well as your mental up until you eventually lose control of something important like your ability to swallow or breathe. My grandfather and mother died of it, and I have a 50% chance of having it. Not fun. Same to compliment, Rabies, it basically speed runs blowing off your brain and is contagious. Luckily it's extremely rare in cities and all, but still terrifying. Legionnaires disease. It's caused by a bacteria that can form in stagnant water if pipes aren't flushed often enough. When my office reopens, no way am I drinking water from the tap for at least a month. I wonder if we'll see outbreaks of it as businesses and offices reopen. I think I'm gonna avoid drinking any water that isn't from home or a bottle for a while then. I needed to read this. Thank you. Not a doctor, but I was once told by a doctor that no one seems to care about Ebola. Super deadly, super scary, but everyone thinks it's just some random disease that exists in poor countries. Today I learned that there is now a vaccine for Ebola that has proven to be 99% effective at preventing the disease. Pretty cool. Alcoholic hepatitis, acute liver injury from alcohol, and cirrhosis, chronic liver injury. We do not really have any treatment for it beyond steroids, that only sometimes help, in the acute period and supportive care. Not entirely clear why particular alcohol toxin exposures result in the acute injury, i.e. some people may be heavy drinkers for a lifetime and have no major acute hepatitis episodes, whereas other people aren't even heavy drinkers and just one bad binge send them over the edge. Our ICU is often filled with chronic liver cirrhosis patients awaiting transplant, and the vast majority do not make it to that point. Cirrhosis is awful. My husband got diagnosed 3 years ago. He has had varices burst, has to have paracentesis, he only weighs 122 pounds, and is 6 feet 1 inch. Med student here. Leigh-Nihan syndrome is something I wouldn't wish on anyone. Most people have never even heard of it before. It's an error in purine metabolism. This syndrome has a ton of symptoms and comorbidities, but one of the most shocking is self-mutilation. These babies often eat their own lips, fingers, and hands. They also tend to slam their heads against objects. They often have to be restrained and either have their teeth removed or wear a mouth guard. Older people with the disease often ask to be restrained because they have no control. What makes this disease even worse though is these individuals are not insensitive to pain. So they feel the pain as they, in lack of a better term, eat themselves. Alright, that's it, I've read enough in this thread for a day. Ophthalmologist here. I'm scared to death of retinal detachments. You could have zero risk factors, be completely young and healthy, and just one day wake up blind. They can come out of absolutely nowhere. As an eye surgeon, if I wake up blind in one eye, I won't be able to operate anymore. There goes years of training and years of school. It's terrifying. Asterisk, by the way, considering the number of people reading this post such as yourself, I wouldn't be surprised if one of you wake up blind tomorrow morning. Sleep tight. Looks like it happens to 1 in 300 people over a lifetime. That's more than I'm comfortable with. My uncle's retina detached while chilling on couch. If there were a doctor in this thread, she would probably say cardiovascular disease. Common cause of death, and patients don't care because they won't die for a number of years. There was an interesting post on this the other day, causes of death, cool guides, reddit.com. In a nutshell, even though heart disease is the #1 killer, nobody searches for it on Google and newspapers don't report on it very much. Not sure if this counts, I'm not a DR but my mom is. In one of her frequent don't do drugs talks when I was a teenager, she told me about Serotonin Syndrome, which sounds scary AF and can happen apparently if you take ecstasy while on certain antidepressants. I'd the exact details, but it involves a really high fever and fucks up your kidneys. Some people die from it. It's really rare though, and luckily did not happen to me despite having used aforementioned drug combination. I've had to go through a ton of antipsychotics, and the one thing that always comes up is NO grapefruit. The reason? Serotonin Syndrome. That scariest fruit has a chance of putting me into an early grave. Mrsa. Super scary. Everyone thinks it's just staph. For the most part it is just staph. It just happens to be resistant to one particular drug, but luckily we have numerous other options. I would say a good portion of the skin infections I treat regularly are Mrsa, and many only require simple oral antibiotics. I am not downplaying the seriousness of antibiotic drug resistance, but there are all sorts of bacteria that are resistant to antibiotics, some a lot harder to treat than Mrsa. The media makes it seem like you get Mrsa, and your body is going to quickly rot away, but that isn't the case at all. Even when looking at flesh-eating bacterial infections, they are often strep A, Vibrio, and/or anaerobic species. I lost my foot to Mrsa, got it from a surgery at a hospital. Not a doctor, but ALS. We have all heard of it. It's the disease Stephen Hawking had, but it's a horrible disease. My brother's father had it. And he lived a little longer than they said he would. At first your speech becomes difficult, sorta like those days when you're tongue-tied and can't predicate your sentences, and it gradually moves to your skeletal muscles. You lose your motor skills over time, and then at some point you'll become wheelchair-bound. From there it's just a matter of time until your diaphragm and respiratory system give in. It's a horrible disease and people should really realize that. My sister's best friend's father has it. Luckily their kids are all adopted, so he doesn't worry about passing it on, but I occasionally go and pick my sister up and seeing him decline has been really sad to witness. Working on my PhD, does that count? Sudden cardiac arrest. I knew a girl who went from standing and laughing to being dead in less than a few minutes. Autopsy had no official cause of death. 19-year-old had been previously healthy, no drugs involved. The thought that despite regular checkups I could go from being totally fine to dead in mere moments, sets my panic attacks off majorly. Not a medical doctor, but deep vein thrombosis gives me the absolute heebie-jeebies. I had a DVT. I went to the doctor and the nurse fucking missed it. Sent me home and within 48 hours I had full-blown bilateral pulmonary embolisms. I am very lucky to have survived. If you ever get a cramp in your leg that flat out will not go away, absolutely insist on an ultrasound. Not a doctor, but I work in a hospital with patients with necrotizing fasciitis. Yikes. I have a cat that had NF. That was an expensive treatment and he was able to keep both limbs. He pretty much lived at the vet for 3 weeks. SIDS is very freaky. Lost my daughter to that this year, we assumed they couldn't find a cause of death. Freaky is an understatement, my dude. A serious understatement. We have another on the way and the thought keeps me up at night. Trauma surgeon. Simple bad luck. I see so many people die falling from standing. Not really a disease, but I have seen things as simple as stepping off a parking block lead to someone losing their leg. Or a 13-year-old girl get scalped when her hair got caught in a go-kart engine fan. Fall from deer stand. Fall through your roof onto your wife while you were both up there looking for the leak. Nephew accidentally shooting your penis and scrotum while looking at a shotgun. Obesity. It's become so normalized, but it will kill you. First you'll become disabled, then diseased, then you'll die. I feel like this is going to be a rampant issue in the future. Nowadays, people are condemning those who suggest to watch your weight and categorizes it as fat shaming. It's kind of like taking away the incentive to exercise. There's nothing wrong with liking your body, but as much as possible, try to be healthy too. Lyme disease. Headaches suck. I will take any other symptoms, but when my think space is literally infiltrated by pain itself, I just want to check out. So I guess meningitis or something that's sure to cause a massive headache. A lot of neurological diseases or genetic disorders BC those are incurable in many ways, although there are some meds out there to help treat it. You are an evil person, and I feel bad for all those with health anxiety. I will now continue scrolling through responses. NAD, but a nurse. Fournier gangrene. If you made it to the end of the video, thanks for watching. Don't forget to like, subscribe and share, and we will see you in the next video.